Sir Dr. Parthiban Nao Sir, Nagili Ayurveda Medical College Hospital Superintendent Dr. Shibu Varghese Sir, Principal Dr. Sunil P.D. Sir, all our respected teachers, Vice Principal Dr. Vinod Bhaskaran Sir, house surgeons and all the students to this session. Let me welcome Dr. Shibu Varghese Sir for introduction speech.
Good afternoon to all. So now we are privileged to have a neurosurgeon along with us. So I had a great regard to neurosurgeons. That regard started when I started reading the book When Breath Becomes Air. Has anyone read that book? When Breath Becomes Air. It's written by a neurosurgeon, Paul Calamina. He had a by the finished with his neurosurgery residency, he had a lung cancer. So based on that, with that time he wrote a book. So in that book, actually, it clearly mentions how a neurosurgeon's journey is about. So as soon as we enter into the medical school for a neurosurgery, we will be made to be ambidextrous. That means you have to use both the hands with the same precision equally. So they will make us to push with the left hand, eat with the other hand, so the non-dominant hand. Likewise, the training starts from there. From onwards, it's going to be a very tiring journey. It's not a very simple task. So, Dr. Parthiban is here. Actually, you might have seen the film Gifted Hands. Have you seen that? It's a very inspiring movie, Gifted Hands. That's also about the story of a neurosurgeon. That means a mischievous child actually who became a neurosurgeon by the constant inspiration of mother. So Dr. Parthiban also asked about the same story to be shared. He was also a very mischievous child during the school days, and even I had seen a few newspaper articles about Dr. Parthiban. That is when he was not a mischievous child, but he was a gangster during the school days. That's what the newspaper, one of the leading newspaper in Malaysia says. He was a gangster during that time, during years secondary school education time. But one person changed his life. It's his teacher. He studied in a Chinese vocabulary school at that time. So there's a teacher whom he referred to as Lauser means a Chinese teacher. Lauser. So he uses the Lauser, the teacher. She's the one who inspired him to become, because all these grades were written in red at that time. In the school days, all the masters were written in red. I don't know why he read actually. Probably that's what the newspaper says, because he also used to get some red occasionally, but he had all the marks in red. That's what the newspaper says. I don't know whether the newspaper is to be believed or not, but still used to be red always. And you know, during the 70s, like in India, in Malaysia, he is basically from Malaysia. So, has some Indian roots in Tamil Nadu. So, there used to be the housing is not to be very wealthy at that time. Very also the same teacher. So, he has to get settled with a single, the family has to occasionally has to get settled with a single meal in a day. So, during the school intervals, his teacher, the Lauser, she spotted him sitting below a Goa tree. Then she called him and asked, then he explained that his plight, that they brought the difficulty in bringing 2 or 3 meals in a day, etc. Then the teacher said that she fed him with this meat, and she said actually, we can always definitely I will be bringing food for you. And she is the one actually who found the talent in Dr. Parthiban, the so-called Dr. Parthiban. No. From that day onwards, he started studying, and with scholarship, he has educated in most of the medical schools in the world, the topmost medical schools in the world. So when I said in the film world, Gifted Hands, it's a real story of Ben Carson. So I think his life story is much more inspiring than Mr. Ben Carson's life story. I think so, because only his mother inspired him to become a neurosurgeon. In this case, it's not another actually, the local public also inspired him to become a neurosurgeon. I think you narrate the story how he became a doctor. He was about to, he joined for an engineering course, and how he turned to be a medical doctor. I think he will explain. Then there's a book in Malaysia called Tough Like Nails. Tough Like Nails. That is the national media of Malaysia published it in the last few decades. They selected 8 personalities. So from a tough battle, how they rose up, because by the resilience and the human spirit, how they rose up and become in a good position. So he is one among the 8 personalities where the national media, the book published with the national media has been reflected. So one among the 8 personalities in the last few decades of Malaysia by this resilience from a very tough times, for the rose up by this resilience and the human spirit, overcome the toughest times and become a very successful practitioner. So now you know from a so-called mischievous child to a gangster. Now people are coming from different countries in chartered flights to see him and to take him to the other countries for very rare surgeries. And I said the friend cousin is a very famous neurosurgeon. He is the one who removed one part of the brain and something released from conjoined pins or something. So that's the first surgery happened in the brain. And we have the privilege to work with him in Singapore Spine and Brain Center in separating a scientist pills. Which the surgery lasted for 92 hours. So last 2 days he was with me, so I had the privilege to chat with him his journey. So that time he used to get settled with a single beam. So yesterday was telling about brain surgery which lasted 18 hours. I just asked him, so what the food in between? He said they are not taking food. Because he gets more energy when the body runs on heat. Because he used to have that childhood legend because we didn't have work hard during without any food testing. The same thing, even during 18 hours surgery, you don't have any food testing. After finishing also, unlike other surgeons, we can't immediately go out of the surgery because after the surgery, the patient's bystanders will be waiting how the surgery. We can't say till the baby woke up, whether his hand is moving or whether her hand is moving. It can be predicted only after the surgery is over. So when you come out and say that she's fine, but she can move the hand also. After the surgery also, the patient has to be there hungry in the operation theatre. It's a very tired work. And he said he used to work 24 into 7, 365 days continuously during this residency. So that much hard work has been put. Because neurosurgeon there's no time. Because you know actually generally neurosurgeon deals with the head. So all this bad things to the head happens especially in the midnight. Because you know the hospital they start swirling when the hospital reaches the home. And it goes to peak by 10 o'clock, 11 o'clock, and finally, 5 hospital beats on the head, and the patient reaches the hospital by the midnight. The stroke happens in the midnight. Also, usually the head injury happens following a drink or something. So, usually it starts drinking by between 8 o'clock, 9 o'clock, and the peak reaches by 11 o'clock. Then the coroner starts, and the patient will go to the hospital in the midnight. So, there is no time. Unlike other things, we can't procrastinate it. Tomorrow we'll do what we have to do. Because just something that's to be done immediately. So, neurosurgeons are the one group of people who works tirelessly round the clock for the benefit of the human being. And neurosurgeons, I respect them because they are the topmost doctors among the doctors. The reason if you want to become a neurosurgeon, you should be good at general medicine. You have to be good at general surgery. You have to be a very good radiologist because neurosurgeons can't depend upon some radiologist reports to something because when they open as things will be different. So there should be a good radiologist. There should have a very good knowledge about the neuroscience. Then finally neurosurgery also. So they are the doctors of doctors, I could say. So it's a special group of people whom we should admire. So this a lot of hard work has to be done to become a neurosurgeon. It's not a very small task also. We should have a very good decision making, accountable decisions. Because when we decide upon memories, we have to take a decision. If we have to remove this tumor, what is going to happen. If you don't remove, what is going to happen? What will be the fate of the patient. So every decision has to be taken on table. They should be very alert, very friendly enough to take decisions on table. Then, so that neurologists, that's one thing about neurologists. And second is, neurologists are the most richest doctors also. That's the another thing, because most of the neurologists abroad all want set jet of their own, private jets. Most of the neurologists want private, because I said I had a friend neurosurgeon, Dr. Bobby. He's on the inaugurator of the rehabilitation center. So he got a new Mercedes. Some you got a Mercedes Benz. All my friends has got a private jet. I only have the Benz. So I don't think he has got a private jet, but he has got many sports car. I think actually from the website to read that he has got many sports cars. So neurosurgeon, even though they work hard actually, because other aspect of neurosurgery also. So definitely this class is going to be definitely inspiring for you. Those are not read the book actually. When Prem becomes here, read that book. Was not seeing the gifted as feeling. You need to see that feeling. These are once you see that feeling and once you read the book, you will start developing admiration to the neurosurgeons. So definitely, I like to welcome sir with the love, respect, admiration. One more thing I need to add is has to be definitely trained. Which sort of English says is much. If you talk AYURVEDA, is much better than me in AYURVEDA. If you talk about philosophy, is much better than philosophy. If you talk about Indian politics, is much better than Indian politics than me. So whichever field they also is much, so it's very difficult to match him or to. So only thing is better we listen. When we say that we can't match this level, it's better to be a good lesson. So one week I am a good listener, which I never used to be. So welcome sir with a love, respect and admiration.
We will now proceed with our session. Dr. Parthiban, who is currently serving as Director and Senior Consultant Neurosurgeon at Mahkota Brain and Spine Center, Malaysia, also holding a post of Professor of Surgery at Taylor's University and Melbourne University, was born and raised in Malaysia. Dr. Parthiban obtained a BBS degree from Malaysia's Union University of Malaya in 1994. After completing 3 years of training in general medicine, he went on to do specialization, first in general surgery and obtained a fellowship degree from Royal College of Surgeons of Edinburgh, Scotland, then further to specialize in orthopedic surgery at Royal College of Surgeons of Ireland with another degree. His interest in complex spine surgery taken him to University of Newcastle, UK, which awarded him a fellowship degree. He later switched interest to neurosurgery and went on to do multi-nation and multi-center training, spanning from Singapore, Australia, and finally at the University of Oxford, which awarded him British Neurosurgery Board certification. After 20 years of practice in surgery and teaching, his interest widened to non-medical field. First began with law, which led him to obtain a master's degree in law with distinction from University of Taylor, then advanced certificate in ethics from University of Harvard, USA, and in philosophy and critical theory from University of Queensland, Australia, and history from University of Virginia, USA. He is currently pursuing a PhD program in Western philosophy of Socrates, Plato, and Aristotle's contribution in shaping Western thoughts. Let us extend a warm welcome to Professor Dr. Parthiban now for graciously taking this session.
Dear Professor Sibu, teachers, and not forgetting the students or future doctors as well. Very good afternoon to everyone. I must be thankful to Professor Sibu for very kind words. Mostly he said is true, except I don't have private jet. It's a truly a great honor and privilege to be here today. First and foremost, I must record my gratitude and thanks to Professor Sibu for his giving opportunity to meet and share my actual experience over 30 plus years in neurosurgery with you people. You are the future doctors and we are the sunsetting era. So it's very important that we share our experiences and inspire you all. I am deeply appreciating the effort and vision of Dr. Sibu and the fact that he has seen that there's importance of integrating allopathic medicine, bringing people from allopathic college to Ayurvedic side, and I think this is how we have to proceed in the future. Right? Okay, we just proceed with, I'm just going to share, it's going to be casual kind of talk. Don't feel free to stop me and ask me questions. Neurosurgery, a journey. It's a science. It's where science meets a soul. Just put it simply, let's say I don't want to use anybody else, I use myself as an example. If I'm going for surgery, let's say I've got a kidney problem, and the doctor says, we have a serious problem, we have to do a surgery, things may go wrong, and if things goes wrong, we have to sacrifice one kidney. Most of the time, we'll plead with the doctor, please, to preserve my kidney and go ahead with the surgery if it is mandatory. And let's say at the end of the day, something happened, complications, one kidney is removed. Come out, of course, I feel sad, but it is still me particle. The same thing happened if I remove half of my liver, it is still me particle. Even if I remove one limb accidentally by surgeons, I can replace it with another artificial limb, but it is still me particle. It's very different with the brain. When you see a brain surgeon and the brain surgeon tells you that we have to open up your brain now, as a tumor we have to remove, I think one of the biggest things that will go through in your mind, will it be me again and waking up from the surgery? So that is a huge privilege for neurosurgeons. Every time I take it as a huge privilege. Because the patient is not only signing their life, they are signing not the life as a living life, their life they lived. So you may be waking up not particle anymore. The very particle that you know, I'm 57 years old. The very particle that you know for the last 57 years no longer will be there in this body. That is something that you have to ponder about being a neurosurgeon. So every time I embark on a surgery of the brain, that's the biggest things to go through. I'm just as fearful, as anxious as the patient. Despite I've been doing this for 20 plus years, almost 30 years. But every case is unique, every case is different. And every person, I've looked at it, it's not the patient. That's why I don't like to use the word patient. It is the person. It's the lady, is a wife of somebody, mother of somebody, sister of somebody, daughter of somebody. She has got a job, she has got friends, she has got meal. And can you imagine at the end of the surgery, she's no longer the person? You deny an entire circles of people, a person. So it's a huge burden in that sense. Huge person. Let's just move to the next one. Okay, this sheet, next. Somebody can help me do it. Because there's a video, you're eating me. I'm a BBC generation, born before computer, so it's not something that I know. Not looking at it. I think video, you don't get video form, and sometimes the formatting is different. Well, that video show a case where I'm doing the surgery in action, but now we get to see the static photo. Normally we operate very high angle patients, and this is much simpler surgery. We have to do like that, but even more a slide where I can show you microscope, because when I say microscope, people always think the microscope in the lab. That's not the microscope we use. I'll show you how big is the microscope later. That's me doing one of the surgeries. Yes, 14, a bit of advertisement time. Human brain is a call to heal the brain. Yeah? Human brain is got 100 billion neurons, 100 billions, and each of them has at least 1,000, some even have 10,000 connections, synaptic connections. So you multiply that, you can see the complexity of this particular organ. Unlike any other organ, where you can remove half your kidney, the remaining kidney still can grow back and function similarly. You can't even remove one small square centimeter of the brain without having a side effect on your body neurology. Because each part of the brain has a specific function that makes it extremely unique and non-dispensable. So we have learned over the years there are part of the brain called eloquent brain. Eloquent brain is part that any damage to it, patient will suffer consequences. There's a non-eloquent, not say non, less eloquent, whereby we can tend to sacrifice a bit in order to secure removal of tumor of the clot with a minimal side effect. Not the no side effects. Just like imagine you have numbness at the back, well, it won't bother you very much. But if you have numbness in your face, it's going to bother you, right? So something of that sort. It's a very fascinating organ, and that's the reason why I got the neurosurgery. Highly complex. It's the last frontiers of biological understanding of human. In fact, we are defined as a human because of our brain, not because of our better kidney or better liver. The tiger, the elephant has a better strength. Almost all the animals in the animal kingdom have a better physical ability than human. But what makes us separate and distinct is the brain. That's precisely how it's unique in the brain. Choosing neurosurgery is a blend of intellect. It requires a lot of reading, and fortunately, my hobby is reading, learning. So, fits me well. And endurance. I do have some endurance, I believe. Part of training is very tough training, long nights. I think Dr. Prof. Sibu has already highlighted to you. It's 24/7, 365, and it's an emergency. In fact, neurosurgical emergency is an emergency that you can't wait. Even every second counts for the outcome of patients. In fact, in operation theatre, there are only two emergency override every cases of operation theatre. It's neurosurgical emergency and fetal distress or obstetrics. Oh, fetal. Those who can't hear, please let me know. Fetal distress, when child got a problem, that's one of the emergency. Number two is brain surgery, acute hemorrhage, bleeding in the brain. These two emergency override everybody's emergency. So everybody has to stop to give them a go. So that's the danger. That's how it works. One of my professors in Oxford always, whenever he recruit new trainees into neurosurgery training, he always say that you must have minimum 3 qualities. Eyes of eagle. You know, eagle can see from 3 kilometers away, a small rat running. So you must have very sharp eyes. You must have hand of steel, steady, no tremor, no trembling. Number 3, you must have a heart of a lion. Why? And in the midst of surgery like aneurysm, brain snap area, 1 millimeter nick, cut, 1 millimeter cut, may mean life, death for the patients. So you have to make the call. Are you going to make the cut or not? So if you are not, don't have the courage, you will back off. If you back off, then you wouldn't complete the surgery. So these are 3 qualities. And I'm sure many of you have that quality. And after I believe this thing, everything gets right. Yes. Let's just move on to the next slide. Sacred theatres, don't worry, I will just move on. I'll just go into some cases, make it more interesting. There's also a link in the video, but I don't think it works now. Let's just move on to this. Healing is not a procedure. Right? Very important. Healing is not a procedure that what you do. It's a pilgrimage. Right? You take it as a journey, you patient's healing process, right? You don't like prescribe the healing and go away. You should be part of the process of healing. And in that I can see firsthand, up close and personal with Proxy, who is always with the patient day and night. I see him roaming around the hospital all the time. So that's the thing. Talking about okay, we'll talk about some cases. This is extradural melanoma. I'm not sure if you are familiar with the word. This is blood clot in the brain, the growing blood clot in the brain as a result of accident. Most of the time, accident or fall. This is the case of a 19 years old engineering college boy on his way to university on a motorbike, met with a road traffic accident and had suffered only head injury. He was taken to a nearby hospital. At the time, there's something called Glasgow coma score, the way it's called conscious level. It was 11 out of 15. 15 over 15 is just like you and me, fully conscious and functioning well. 11 out of 15 is, okay, you lost about 4 points, still conscious. So the call came, referred to my hospital, and we say, send over the patient. By the time the patient arrived at my center, his score has dropped to 3 over 15. For those who are not familiar, 3 over 15 is the lowest score. There is no 2, there is no 1, there is no 0. So 3 over 15 with a fixed dilated pupil is considered the brain is non-functioning, zero function. Often the heart is pumping to the young man, but the brain is not functioning. Most of the time we just leave them alone and wait for a couple of hours before the heart stops. So it's almost. But I look at the young boy, he's 19 years old. Mother was crying, elderly mother. And I told her, if you want, I can try to do the surgery. I know there's blood clot there. But I don't know. We say, doctor, what's the percentage? I say, maybe 1 or maybe less than 1. And she's very positive on this. She said, doctor, even 1 is good enough for me. Because the other doctor says 0. I said, okay, 0 to 1 is 100% actually. Right. So I went to do the surgery. I had to do AASP immediately, almost immediately. So I didn't have a time to shake his hand, I didn't have time to clean up the iodine, the usual preparation will take 20 minutes. He doesn't have this 20 minutes. Every second count for him. I went in with nothing cleaning, no anesthesia. Anesthesia is not arrived yet, we started the surgery. He's deeply in coma, he's actually dying. So literally he's not in a big pain. Operator on him, even to me it's a surprise. It's a miracle actually, not because of me. I think his God decided that he should leave. He walked away fine after 28 days through the ICU, general ward, recovered. And 3 years later, he sent me an invitation for his wedding. Now he's got 3 kids. Every time we come to the hospital and show the kids, this is the doctor who saved my life. So sometimes, but it's nice to see this, right? See them going. So that's one of the cases. This is the effect of the clot. I mean, those who don't like blood, just don't faint. So that's a blood clot. Can you see that? Like, this is a blood clot, fresh blood clot. This is when you're not eating. I open up the brain and to show you a pictures. This is another interesting case. It's a 22 years old Indian girl. When I say Indian, Malaysian Indian, right? Malaysian Indian university student who had a VP shunt. The shunt VP shunt is a ventricular shunt because there's a blockage in the brain fluid. It's supposed to spinal fluid. You're all familiar. They implanted a tube from the brain passing through the body into the abdominal cavity as a child. And it has worked well all the way for 20 over years. So happened that particular day, the shunt got blocked. And the shunt got blocked, they develop acute hydrocephalus. Very fatal condition. They develop acute onset, severe headache. And normally it's unbearable headache. The patient will be actually rolling on the floor, holding the headache. Really miserable. They lose vision fast, they go blind very fast, they'll be vomiting non-stop before they become unconscious. And only once they reach that level of unconsciousness, it's too late to save them. I'm so happy as a senior consultant, I finished my long surgery. As a habit, for particular reason, I always leave my suitcase in the ward so that I'll be forced to go back to the ward. On the way, I'll just see what's going on in the ward before I can go home, So I saw this one cubicle, families are crying, mother, father, brothers, and all the Indian families are all crying. And I went, because it's not my day, I just finished my work, I just pick up the suitcase and go back. I already promised my family said I'm cooking a early dinner. Then I asked the nurse, I said, what's happening there? He said, there's a case, a suspected BP shunt block, but the surgeon on duty was 2 years later. He's not sure, and it's Saturday, so he decided to do the scan on Monday. Can you imagine? And these are the neurosurgeons of the newer generations. I say, what? If you suspect an emergency, you don't wait for office hour, public holiday, or anything. He said, normally the radiologist won't give the appointment to do. That's not radiologist, it's not radiologist patient. It's your patient. You should go and bang the table, I want the scan now. So I went to see her, then only when I saw her, I said, these girls are dying actually. She won't live for the next 3 hours or 5 hours, let alone on Monday. I called up the radiologist, I shout back the table, the radiologist says, Saturday, we are going home. I said, you're not going home. You are doing scan for vibration now. And he told me, are you willing to come with the patient? I said, yes, I will push the patient myself. I show my commitment. Then you show your commitment. Go to consultant. He told me, right? So I will push the patient myself. You come back from your car park. So when I had a scan done, immediately taken to the operation theatre. Had to do surgery. The moment I removed the shunt, the CSF was shooting right to the ceiling. That high is the pressure. And the very next morning, I decided to come and see the anyway. Operator, you must have a commitment when you do a surgery. Though I'm not working on the day. I came back on Sunday. She's having breakfast. And that's cut the long story short. I thought it's over. Fine, she went back to the next day. 20 years later, she bumped into me in temple. She ran to me and said, Doctor, you remember me? I said, I thought I remember your face very clearly. And she said, Doctor, introduce to you my two doctors' son. So, sometimes it's very rewarding in a sense. Very rewarding. That is the scan of the, this is the ventricle. Those who are familiar with me, I think Dr. Shivu is familiar with the scan ventricle. This is our structural ventricle. So, I'll show you the size of normal ventricle. Normal ventricle should be just like this. Can you see the difference? This is the water in the brain, and this now is blocked. This is another case. I think I spoke to Dr. Shivu. It's a 12-year-old Chinese boy who came from Indonesia, from a very wealthy family. They actually flew in by a private jet. They've seen many doctors from Australia, Singapore, Indonesia, and elsewhere. And they heard about my name, so they decided to come and check me, see whether I can help differently. He is suffering from progressive pulmonary paraplegia, basically upper limb, lower limbs, and losing power. To the point when he came, he's in the wheelchair. And he also started having problems with swallowing because of brainstem dysfunction. And he was told by the CTC, all the doctors, that he's got a tumor, I think this another slide, pontine glioma, which is actually, if it is pontine glioma, it is non-operable. And most of the time, I've seen patients with pontine glioma. Very sad, they normally die within 6 to 9 months. Quite miserable. They lose function one by one, bedridden, unable to swallow, aspiration, and then stop breathing eventually. This particular case, as Dr. Sibu said, is always better for you to see the scan yourself rather than relying on another person's report. So I said, I want to see the scan. I looked at the scan carefully. I have been fortunate that I've been taught by very prominent neuroradiologists in the UK. He told me that particular sign, if you picked up, that's a very special variant which is operable. So I saw the particular sign. I told the family, this particular one is not what they say is a glioma. It's pyelocystic astrocytoma, which is operable, very high risk, but nevertheless is operable. Family refused to believe me because they say all the doctors from Australia to Singapore, everybody told me it's not operable. Doctor, you're the only one telling me it's operable. I say it's up to you, actually, literally up to you. They went home, number phone call, they went and checked again and again, came back to see me again and again. I say, really, it's up to you all. If you need a help, I believe in help. It's high risk, even my surgery can fail. If the surgery fails, we'll die on the table, on the operation table. Finally, they agreed. We went on to do a very long surgery. Throughout the surgery, the heart almost stopped many times because we were operating against time. The heart rate dropped to 20. In fact, anything less than 20, the heart would stop suddenly. And struggled through. But finally succeeded. Today he is walking, he is attending school, he is actually going to college already. So the importance of reading was quite confident. So most of the patient most likely have seen allopathic doctor and was not happy with the outcome. Then coming to you, they will come with you all investigations, CT scan, MRI, blood test, ultrasound, whatever. Take an effort to learn. You can always learn if you are very clever. If you don't know, you can learn from other colleagues. You cannot rush out any scan, any finding the patient is making. You look at it, say, yes, I understand what's going on. Then you offer your alternative. If you say, no, I don't want to read any of this thing, I'll just take Navi and then I check my home and I'm giving dispensing inquiries. Immediately they lose confidence and how is it you call yourself a doctor and you don't understand anything? So don't do that. Don't do that. It's an investigation of the patient. It carries some value. You may find something interesting in it, may help you in formulating your diagnosis and formulating your treatment plan. Right? And having a very good example is Prof. Siku himself. He sees through all the scans. So that's one case. This is the case of Dr. Van Carlson, Professor Van Carlson. Can you see the chart? Not fantastic. You can see there's another baby here and one baby here, joined at the back. Two childs and two babies, 11 months old. Van Carlson's story, we'll start with this first and I'll tell you about Van Carlson. This is Dr. Van Carlson. When he was much younger, this is 1987. Right? Now he's 70 years old now. And he built a model of the actual model of the child. From that, they simulated how to separate these two brain and two heads successfully. And it's no small feat. And no one in the world had ever done before. He took up the challenge at John Hopkins University Hospital. And I think, forget the photo, it's very gory operation. So I spare the photo for you all. These are the end results. Two childs, separate babies, alive and well. And it was first successful. This is first in the world, 1987. First in the world. And this is the team led by Carson, where the history takes the first neurosurgeon successfully separate conjoined between and the back of it. This is his team. This is the book Prof. Sibu was talking to you. This is the book he wrote actually book. Later became a movie. It was launched in 2007. The book was 1990. This is one of the books inspired me. I was in the university about to finish. So it inspired me as well. Van Carlson did that. Interesting story. He's the first black to come from poor background in the Bronx area. First they say they denied him from medical school. By merit, he proved that this worthy he was number one. They cannot deny him, so he was number one medical team. Finished medical school, they say, Bangkok. He said, I want to do surgical residency. He said, no surgeons, no black surgeons in this country. He fought by exam and he passed number one. So they had no choice and can't deny him, gave him a residency in surgery. After surgery, he wanted to be a neurosurgeon. They say it's too much for black men. He proved himself worthy, passed, went on with the surgical program. Eventually, he became the chief of the neurosurgery program at John Hopkins. And not only that, he created world history. First to do a joint separation. From him only we learned how to do this particular type of surgery. The second story part of it, he inspired me through his book and letters in the movie. But more importantly, I had a privilege, and with the God blessing of what, when I was in Singapore, this is my Singapore experience. There was a twin couple, child, conjoined at the head, acknowledged. His name Ganga and Jamuna Srinta. I don't know how to pronounce it. It's a very Sanskrit name. Ganga, Samuna, I know Ganga, Jamuna, and Srinta is the name. This child came to Singapore, and first thing first, he said, nobody have experience doing it except Dr. Van Carlson. So we invited him, he was very kind. He came, he sat with us, he said, that time he said, I'm too old for prayer. He made a very steady hand, he said, I'm too old for prayer. But I can tell you all the problems that you will face. I'll be with you in the operation theater. I'll tell you what to do when things arise. And it went on to 103 hours. In operation theater itself is 93, the remaining was another thing. So we had three teams taking the round the clock. I was one of the team. And successful. I think that's another photo of it. Yes, there's a post surgery, two baby. Because the conjoint at the head, they cannot live life. How to live life with a hip joint together? Right? So it's separated successfully. Yeah, that's the name. 11. I think the name is somewhere there. Okay, that's about surgery. Sorry? Yeah, there are. That time there was only 11 months old. Now they will be like 20 years already. They're okay. They're fine. They're fine. Normal, right? They're normal. They had hand grown and things. The two girls, Jamuna and Ganga and Sri House. So that's one of my part of clinical work, surgery. The second duty I have is as a teacher. So I'm teaching in two universities at the moment. University of Manipal, not in Karnataka. Manipal has got a branch in Malaysia. Second is University of Taylor. I have some of my photos. These are all my happy students. I come to clinics. I teach them. I normally show them my clinics, places. Number of photos. They take the photo and send to me. They want me to show people. This is my clinic, actually my practice. This is a number of photos. And actually many of them are Indian students. Many of the students are from India. I'm not sure why this is cheaper to do it in Malaysia than in India. So they come. Secondly, they also want to go overseas to see new things. So like this student, his father is an orthopedic surgeon, professor of orthopedic surgery in Manipal, India. I sent his son to do Manipal in Malaysia. And okay, I just received one of the award last year. First time ever they gave an award for ethical doctor. It's a golden ethical heart award. I think there's a photo, a little bit of self-promotion. Lady, Dr. Abhika, she is the only Asian lady who received some special award from White House in the Clinton administration. Yeah, so you see, she's a top lawyer, one of the country's top lawyer, and president of the bar associations. She is the patron of the society awarded from the award. This is the book Dr. Sibu was mentioning. I was supposed to be there yesterday, book launching, the launch of the 8th. You can see the date is on the 8th November, so I'm here as his guest. So the publisher sent me the book. I have not seen the book myself, so I would like to see the book. I was nominated or elected, selected as one of the 82 journalists who come from art shapes. Just an advice from my personal advice is, I was told from young, nobody guaranteed anything to you. That's number one. You must remember, nobody guaranteed anything. Even God, we don't know what guarantee is given you. That's an unfortunate situation. Right? God knows what's going to happen, but they never tell us. Number two, don't think suffering. People make mistake between suffering and struggle. It's an English word, but has a specific meaning. Suffering means you are under tyranny or control of someone and you are helpless. Struggle is the same situation. It may be the same situation, nothing changed. The factual situation is the same. The reality is the same. But your perception can be different. You can choose to be struggling, it's your choice, and fighting the hardship. You know why? The end of the struggle is a victor. Winner. End of struggle and end of suffering is a victim. So if you think you are suffering, you will be forever a victim of the situation. If you are saying that it doesn't matter, nobody promised me these things happen, I will find it through, struggling through. Definitely, you will come out as a victim, not as a victim. And I tend to see this difference between many students. They think they're born poor, or met an accident, missed the exam. No, all these are excuses. We have no control over the external event, but we have control of how we see the world is. What's happening? So make the distinction between, don't say I suffered, say I struggled. Because struggle is a choice you make. You make it. And at the end, you come out as a victim, not victim. Little thing I can share with my side of stories. See anything. Okay, remember I told you about microscope? Remember, you have microscope in your labs, right? Does it look anything similar to this microscope? It's nearly, in Malaysian money, it's 1 million Malaysian. It's 1 Malaysian ringgit is 20 rupees. So fantastic eye-hand coordination. You have to learn it through very long years of training because you are looking there, operating here. You see, it's not intuitive. For you, you want to do something, your eye will be looking at where you're operating, right? In here, you're looking straight up on the computer screen, the microscope. But you're operating. So you have to coordinate these two. It takes long years of coordination. And every millimeter count. In fact, this is one of the surgeries where we have, sniper, military sniper, right? Your military sniper, the guy who is sharpshooter, they have to control their breathing before they pull the trigger. What you may not realize, there are systolic phase and diastolic phase. What you may not realize, you can find it out when you're operating in a microscope, sitting in a microscope. In a systole, your body expands by 2 to 3 millimeters. Expand. Systole. The whole blood system is expand, right? So in the microscope when operating, during systole, my hand moves to about 2 to 3 millimeters forward, not ideals, it just expands forward. And diastole is reverse. So when we're putting a clipping and aneurysm is like a bomb, time bomb in the brain. You have a clip, titanium clip. The clip has to go in and let go. You cannot let go when it's coming back. Then you pull the aneurysm. Once it's burst, the patient dies on the table within 3 to 4 minutes. There's nothing you can do. Nothing you can do. Once it's burst on the table, you just lay, close the skin, send the mortuary. There's nothing you can do. So, clipping aneurysm, the surgeons are trying to control the breathing. We control the breathing. Millimeters. In the millimeter, the microscope can feel this distance, this much distance. Because this is magnified very hard. Can go up to 40 times magnification. So this is the microscope. So when we say operating a microscope, this is the one. And a surgeon, also a surgeon, like when I operate a microscope, I sit there quiet, dim the lights, play music. We want the white noise. Because people will be chatting away here and there, they don't want to distract them. You play music, nice music, baroque music, the rhythms synchronized with your heart rate. Baroque. So if baroque music is good, you want to sit down and study. You just Google away baroque music. It synchronizes your heart rhythm 60 to 80. They have tempos. So it calms your heart, listen, and you must go into a zone. There's something that sport physiologists will tell you. Athletic, when they go into the zone, nobody exists. They alone can perform it. So in surgery also, we have to go to that zone. Once you're in the zone, I no consciousness of anything outside the microscope. Everything in the world is inside there. That's the commitment you have to have in order to do certain surgeries in brain to save people's life. Okay, you don't have to just be a doctor sitting in a hospital day and night. Take up some hobby, especially athletic activity. One of the things I learned is mountaineering. I'm a very heavy mountain trekker. This is one of the trails I was taking to Everest Base Camp. Some of our doctors may not see my face, it's all covered. Everest Base Camp, that's the stone that everybody will take to show that you reach the base camp in Everest. I'm on the way up. I also went to Annapurna Base Camp. Annapurna is like the second or third tallest base camp. I haven't done anything in India, to be honest. One of the places I want to do is actually Hungary stop Hungary stop in Ladakh. Someday I'll go. If any of you are interested to join me, please contact Dr. Sibu has my contacts. So this concludes my talk on the journey of a neurosurgeon. And so I hope, I'm not sure how much it's going to help you all. If they can convert one or two of you all to do neurosurgery, that would be wonderful. Right? And so that's part one. The second talk, I think, is can somebody have another talk? For this, a lot of you, up to here, does anybody want to ask me anything? Any burning questions? Brain, neurosurgery, microscope, or tracking? Anybody want to join me for tracking? It's Ayurvedic versus allopathic medicine. Just doing a clinical and philosophical comparison. And of course, I don't have to teach you all anything on Ayurvedic, not that you need my teaching. I'm not they are generalized to a cohort, right? So your hypertensive patient is the treatment. They don't look at you individually because we don't have a physiology for you individually. Unlike Ayurvedic system, you have practically you study the doshas of the person and then you tailor your treatment according to the person's condition, right? So Ayurvedic is actually very holistic, emphasize on body, mind, and spirits. I don't have to mention much on the Ayurvedic part. Origin allopathy is quite recent, right? It's just 19th century European model. It started with biological model, biology and pathology. And it's basically we tell you as a disease is the deviation of normal physiology, right? Deviation of normal physiology. What we aim to do is to remove the symptoms, remove the symptoms, and to restore the organ function. That's it. Once you have kidney failure, you try to restore the kidney function. That's it. You say that you go home. That's how we work. But for Ayurveda, it's a system that's almost 5,000 years old, and you're looking at balancing. You're looking at your philosophy is that ill health is coming from imbalances within the doshas, and you are aiming at the harmonizing body, mind, and soul through your natural law of how body functions. Clinical research. Allopathy uses randomized controlled trial. It sounds nice on the paper, very scientific, very statistical evidence. But the reality is far from that. The reality is a handful of huge pharmaceutical companies. They are so huge, they control the research, they control the results, they control everything. So literally the doctors are just there to prescribe what they want you to prescribe. That's the sad state of allopathic medicine has come. And they do research on the area where they can make money. You see, pharmaceutical company, if they created a molecule, they are inventing or creating a molecule. They can patent the molecule for 10 to 15 years. So 10 to 15 years, they have the monopoly to produce and sell at whatever price they deem necessary. Unlike Ayurvedic, it's everything natural. You can't patent anything. And often you just share with your colleague that hey, this thing works. Try it with your patients. So it is very different approach between one is highly capitalist, one is actually very socialist approach to medicine. Right? And we have come to the end of capitalist model. Today most patients cannot afford a good medicine because it's all highly priced, controlled, monopolized by few companies. And the good thing is, Ayurveda now come up with a modern approach. I think there's something called biogenomics. They started, and they are doing the reverse pharmacological medications. Right? You take your herbs, you run through pharmacological tests, and you validate the potency, the efficacy. So it's almost akin, you are embarking a scientific approach to ancient practices, which is the most welcome approach to the medicine. Allopathy, focus on allopathy opposing a symptom. That's all it means. Synthetic pharmaceutical, so all the medicines are synthetic, artificial, chemical, basically. We use surgery, we use radiations. On your side, you use a natural herbal formulation, panchakarma detox, and variety of other natural way of healing the body. It's very highly personalized, and they're looking at a long-term preventions. Modern medicines are very good at acute and emergency, plus infections. These are three areas you would say that allopathic medicine has done well. Chronic illness, lifestyle illness, we find terrible. Actually, you're never able to manage or even understand what's going on. Why hypertension? Why hypercholesterolemia? Why this? We have no clue. I think the Ayurvedic side, they knew it very clearly. These imbalances within the system, and they are restoring the balances. Allopathic spiritual approach or philosophy of it is very materialistic and mechanistic. Right? It began with 2,000 years ago in Greek. They have looked at the human body function separate than the nature. From then, for the next 2,000 years, we have treated body as a separate from the nature. Unlike Ayurvedic medicine, they believe the body is part of the process of the natural process. We believe in the 5 elements, balances of it, all that. So the dichotomy took place about 2,000 years ago. And at some point I believe that we need to make the correction. perfection. Human body is not separate from the nature. It is part and parcel of the natural process. So in here, they take it very materialistic or mechanistic, right? Healing is physical restoration and symptom control. For Ayurvedic side, it's a harmony of body, mind, and spirits. Advantage, disadvantage, limitation, let's just, I guess you all know about it. Approach. What I would, okay, don't worry about this part. In conclusion, I think the right way to do is integration. And I have come from integrating small scale. I didn't have a formal education like you all in Ayurvedic medicine. But my first introduction to Ayurveda is a book, another book that I should have put in this slide, but you can Google yourself now. Perfect Health. When I was in medical school, I gone through like you all, anatomy, physiology, biophysics, pathology, all sorts of things, and then went to clinical discipline, start learning diseases. And some point, patients always ask. I sit in the hospital all the time as a student. I learn medicine from the patient rather than the book. That's what my professor always tells me. Learn medicine from the patient, not from the book. The book is for you like time. You can't sleep, you read the book so they can sleep. Otherwise, the patients will be teaching you medicine. Patients always ask you, doctor, what's the right way of eating? What's the right way of sleeping? See, I've never learned this. Anybody teaching me what's the right way of living healthy? Went through the whole library, there's no single book of telling you how to live right or healthy. All the book how to heal when you're sick. And that's what allopathic is about. So I went to normal library or bookshops, I was looking through, I saw a book, Perfect Health by Dr. Deepak Chopra. You might have heard the name. You can Google it, you got to Google now, you can just Google Perfect Health. He published the book in 1991. I was just about the time looking for this particular book. I read the book. He is American board certified endocrinologist, Western trained doctor. He is trained in India, retrained in America, fully certified professor. He heard about TM Maharishi, Swami Maharishi. He was healing people. So he said, how can this Indian fellow sitting there telling me he can diagnose people by holding pulse? He said he wanted to go and see. He went there, he saw people long queue lining, all he does is moving the pulse, taking the thumb high and telling your kidney stone, go and see the doctor. If you want, let them comfort. So he went and approached him and asked, like, how do you know his kidney stone? He said, I can feel it here. He said, how can you feel it there? You don't feel anything there. And he took interest, started learning under him, and he wrote that particular book for lay public. So if you have friends and family or even allopathic doctors, friends, or maybe your sibling, I have known some doctors, brothers and sisters studying in Western medicine. Introduce them this book, Perfect Health by Deepak Chopra, Dr. Deepak Chopra. Give them an introduction of what Ayurvedic medicine is, how they give the body. That piques my interest in 1990, Ayurvedic. And I say, I'm already on the field of becoming a surgeon. Okay, let me do surgery. But at the same time, I can always learn things. There's no ways of learning anything new. And I'm practicing on myself all the little things, and that's one of the reasons I think I do my Panchakarma on a regular basis and learning here and there. I also now start using it on the patients. You see, one of the things I put is pharmacological experiment, I need new drugs. The results will be like this. 30% of the patients respond excellently. 30% of the patients borderline response. 30% maximum side effect. And the modern scientists have no explanation. They say this is the nature of the thing. Right? So at least it benefits 30% very well. One more 30% have borderline benefit. I was looking at it. They never distinguish the patient based on body types. So obviously different body types respond differently for every substance they consume. I'm telling you that slowly. I realized people of Vata origin, with the Vata strong Vata, you don't avoid this certain medicine because they become very agitated. Some people of Pitta, I'm not expert, but some other can pick up that strongly Pitta person. This is to be avoided. When I tailor the medicine, according to that, they turn out very well. So I always share that with my other colleagues, but of course, Western brain doctors, they brush it out, they what nonsense is speaking. but it works. So my little take-home message here would be, I think somewhere you all have a duty also to share, to encourage the other side to come and try and say, look at it from our side. There's not anything that benefits the patients. Why not? We shouldn't take this. This is not a profession to make money. Of course, you do make money eventually, but it's not a profession that starts with the aim of making money. It's not a profession that you aim to protect the turf, your ground. We are there for common reason, to heal people, to heal patients. If you heal it, it doesn't matter how you skin the cat, if the results are good, it's fine. So that would be like my last take-home message, that you all have, every time you meet our resident doctor, do explain to them and tell them, there's this book you want to read, you read about this book. I don't know if we all read the book, but most probably you all don't have to read it. It is for the lay public. Perfect time by Dr. Deepak Chopra. I should have just downloaded it. I think that's all I have to share today with you all. No? Anything to add from here?
Thank you, sir, for this truly insightful and enlightening session.
Got any questions you can ask me about the neurosurgery, like the doctor, anything you can ask.
Sir, I have a question. I guess you are also taking this Ayurvedic medication, right? Medication and treatment currently, right? So, by embracing Ayurveda, like the integrative part, what do you expect? And what do you think is Ayurveda is having this role in integrative medicine? Or this will be this may be the future of Ayurveda and allopathy in neurosurgery. Like, what do you think about that?
You see, you are living in the right junctures of the time, whereby we are seeing the end of the Western medicine approach. Right? As I told you, all the pharmaceutical companies are coming out with drugs that is not accessible, not affordable, and that is squeezed, and they actually cheat on the results because all the studies done is sponsored. The studies are $1 billion studies, it's not cheap. They say to create a new molecule, when they say new molecule, new pharmaceutical drugs, it costs $10 billion. Who would have $10 billion other than free pharmaceuticals? But just imagine if they invested $10 billion, they have to be successful. When they're successful or not, they will be successful. They will sell it, they will free to one say, no, are you sure? You can't. You're very good surgeon. So he was forced to do. They decided, and that's the end of it. Die on people. And the lesson to take home is, if you are emotionally invested, you don't be the person who provide the decision or make the decision or provide the treatment, especially if you're talking about treatment that can have immediate consequences. Right? It's not like trying a medicine, although you're working on medicine, because one can't go on. So when I was intentions, it's very difficult to practice, extremely difficult, because on one hand, I invested so much of time talking to the patients, talking to the family, talking to the family's family. They come again and go because it's a lifespan of life in their situations. So you know all of them. You know all of them well, like almost personally. Yet in operation theatre, you have to be very, very objective. Extremely objective. And it's a thing that you learn over years. When we say surgeon or three phases, first phase surgeon learn how to operate. And when you're a young surgeon, you only learn how to do so many surgery. Second phase, when you become more senior, you learn when to operate. And the more senior surgeon will tell you when not to operate. Right? So that decision, when not to operate decision, is also it's a very difficult decision because you're learning patient. That way. So that's the way to take it.
My question is importance of rehabilitation in our Panchagatra in implementation of post-surgical cases like MBPG and paraplegia.
See, I can't overstate the importance of these patients. We can't. Often we are not trying to keep the patient. Right? I'm sure you would have seen many. The surgeons can't. But the healing takes place in rehabilitation. On top of Panchakarma, I'm not that familiar. But definitely rehabilitation, one form or another, is mandatory. Often the neglected aspect of a surgeon. Surgeon only interest in cutting, stitching it up. But I always tell the young surgeon, and I'm training surgeon as well, I always tell them, you can't use stitching up. There's not end there. The healing must take place. So you must provide the healing environment. So I try to refer patients to right people. We have definitely nutritionals, we have nutritional dietitians to help the healing, because cut and stitching practice, healing takes place only on the surgery. So to your answer, rehabilitation is extremely important in neurological condition. Not only neurological, any surgery, any incision made is a cut. And healing is the body, not the surgeon. Surgeon cut, body heals. Surgeon collect fees, take the credit.
Any other questions?
Okay, let's start with the special.
Free like this. Since here actually we got this opportunity, because otherwise there will be a lot of nurses will be very, very busy. So utilize that opportunity. So nurses, why you usually see them once in a week or something to see the nurses. So that's what my friend says. Yeah, Mr. Dudley, what's the importance of 1 millimeter? Sub-millimeter, how important is 1 sub-millimeter? If the scalpel was right, the vision may go, or the hearing capacity or hand may go paralyzed. So that much precision is required for a neurosurgeon, sub-millimeter precision. During the breath, as he said, actually, it may go sub-millimeter front, and aneurysm can rupture end of the patient. So what's the importance of the sub-millimeter in leg? How can you answer to a doctor? That's what they want to know.
Okay. It's fascinated about that. Both my parents did illiterate, actually did in school. So, and I also feel that education is important for where they come from. So I was left alone to do whatever I like. And I was in Chinese school, being only Indian and Chinese school. And I used to be a very small boy. And the Chinese children tend to be well fed and much bigger. So they used to bully me all the time. So I used to watch some Chinese Kung Fu movie. There's a flying kick. Because being small, you can fly when you're young. So in order to tackle that, I'll run. If they bully me, I'll run. They will laugh at me. Then I stop. They're wondering when this will stop. From there, I'll pick up my speed and run and straight kick on their face. And then this been seen by other gangsters. They say, this boy is potential. So I was recruited into a gangster. And that helped me to protect myself against all the bullies. So I've started to become the bully rather than being bullied. Went on like that for a while until a teacher, right? I think Dr. Sibu is mentioned, teacher was there, spotted the potential in me. She's been always very kind. I didn't have money to buy food, so she used to bring food for me for lunch. Otherwise, I'll eat guava. When everybody's sitting like I did, I'll eat guava free. And she saw it, she picked me up, and she told me that every day I will prepare some lunch box for you, you come and pick it up. And she cared for me, and I never understood why. But she said, there's a good in you, there's a good in you, there's kind of you. I'm a big mistake. What just looking at. That I didn't understand. But, you know, when I reached a turning point, a decision is kind of watershed moment. In Malaysia, the rural system, when you reach a year, I think year 10 from Kuala Lumpur, that will be the last year. If you fail that exam, you will have to leave the school system and find jobs. So that time I was like 14 years old, 14, 15 years old. And at that point, another teacher told me, okay, Fatima, fine, have fun, do whatever you like. This is the last year of school. And I was in the B class, A, B, C, D class. And it struck me. And that teacher would say, you actually have a potential, but you don't realize it. When she said it, I remember the first teacher who came for me, consistently told me that you have kind heart, you will help people, you are just naughty, you're just being naughty. Right? So I had a very difficult, that 2-3 nights I couldn't sleep. I'm thinking through what I'm supposed to do now. So in order to stay back in school, I need to pass all the exams. And I started to buck up. And then from there is history. I changed from D class. The next year I was in the 4 science class. I was around the top. And so I've never brushed off, never looked down on anybody, because everybody has a potential. Everybody has a potential. And that one decision, 1 year, things change. And beyond that, I've already proposed all through. And all through just that 1 year. So people from my school, the first 3 years of secondary school and earlier years, they couldn't believe this. I couldn't believe it. This the boy is gangster, D class, after he was an exam. So that's how from the headline newspaper is from switchblade to scandal. That's a headline.
Thank you, sir.
Yeah.
Is that I searched the name from that paper. So is that most famous or most popular newspaper in Malaysia? The front page of that paper is shown the photo of me with his teacher. How that teacher inspired and changed his entire life. Such a great thing to do.
Thank you. Just want to add one thing. You just, I'm back to your days. See, just like, I'm not familiar with cricket, you mentioned cricket, you play football. So let's talk about football, like David Beckham, Messi, Ronaldo. Each of them, you go and ask them, how do you become so good want to be like that in the personal life, but in your professional life, who do you want to be? If you don't have a hero, you will grow up to become a mediocre doctor. Mediocre doctor just get by. But when you have a hero, you will emulate, you want to be like the hero. And of course, your hero is always one of the top doctors in that particular discipline. Right? So, please find a hero. I can assure you, Dr. Sibu is a brilliant hero itself here, those who want to do that discipline. So, all of you have to have a hero. If you don't have a hero, trust me, you will be just a mediocre. Just like the footballer, you ask anybody, be a footballer, be even the movie stars, they all had their heroes before. When they're young, like when they ask Rajinikanth, I'm a fan of Rajinikanth. In case you guys are now on Talapati, what do you call it? Vijay. Rajinikanth, when asked him, his hero was Shivaji Ganesan. He said, always try to act like Shivaji Ganesan. He wants to be like Shivaji Ganesan. But eventually he became a superstar himself. So the lesson is, each of you in your professional life, you must have a hero. Look around, you'll find one hero that fits your description, fits what you want to become, and then works towards it. Then you will become, you yourself will become another hero. Pick up a hero, just like I have my heroes.
Good evening, sir. My question is, what are the ethical dilemmas do a neurosurgeon face and how we can handle them? Ethical dilemmas.
Oh, ethical dilemma. Oh, many. The common things that I face when you have limited resources. We have a patient, a 72 years old man, come with a stroke, hemorrhagic stroke, come with a neurosurgery. We've done an operation, and he's going to do slow recovery. He needs a ventilator. Ventilators in there. And then later, 3 hours later, 19 years old boy come with a head injury, hemorrhage in the brain. I can't do the surgery until I know there's a ventilator for him. Now there's only one ventilator, they can buy one home. It's a very tough call. Normally the call like consultant, senior consultant, and I've made this call many times. Who deserve better to leave 70-year-old man or a 19 years old boy? So sometimes we make the call without talking to anybody. It's not happened behind the door. We tell the nurse, reduce this, that's slowly. I'm taking this boy for operation, but it is 3-4 hours. You already go downstairs with this good mind, and this can clean the ventilator and switch the board. So that's one. But two, patients who are, you are embarking in the surgery, you know if you go on with that particular pathway that you choose, he will be persistently using these things. He will be forever like that unconscious. Or you can switch the surgery that he will die within the next 40 hours. It's a hard call. Sometimes there's a saying, even gods know he is not neurosurgeon. So sometimes neurosurgeon play gods. Not the role that we like to play. At some point, some stage, we are in a position to have to play God. Decide to go or not to go. If not to go, we will have to die. If you go and do the surgery, you're only leaving him perpetually for the rest of life. Vegetative state, like lying there in the bed, that's it. That's the tough question. Good question.
As far as the doctor is concerned, ethical things are the most important. So recently I read to one patient, was a patient looking for a cervical problem. So he said, we will just screen the pain for some of the purpose. I have seen a pituitary system. So by seeing that system, I referred to a neurosurgeon. He said, he took a contrast scan, and he said, you have to follow up after 1 year, etc. So after consulting that neurosurgeon, the patient came back to me. So Dr. Parthivan at the hospital, so I just called him, I just get this how he looked at it. He looked at it and said that this cyst which is there, either from the childhood or during the pregnancy has developed. There's no need for a repeat scan at all. Only thing what you have to do is that just observe the field of vision. If that cyst grows, the chance of growing is absolutely grows, what will happen? The field of vision is slightly diminished. after this, after he said this, actually, I have seen that the tears was coming from my eyes because from there the doctor said there's a tumor here, actually, it observed this growing hormone, she was completely stressed. When he said that you never know, it was like a scar, he explained that once you had a wound, actually, you develop a scar. It was like that during your pregnancy that it will be first to secrete more, so that time actually this has been developed. You never grow, sometimes it will not be there with the child because an incident of like you didn't have any symptoms. You're worrying about that. Just leave yourself. Only thing if you are concerned, don't do an environment, just see the field of vision. So knowledge is also important if you are to be thinking that's more important because by seeing by seeing the MRI content is an astrocytoma, right? The astrocytoma is open. So if you have to be ethical, you must have a knowledge also. And this is over expression of the symptoms of frightening the patient is not the way. So just by these words and they are seeing the tears from the extract knowledge.
Medical field is actually lifelong learning. So somehow or other, at this stage, you think that the moment you get the BA, whatever you think, bachelor, once you get your degree, you thought that you finished learning. Discard that idea. Learning is lifelong. And every patient will bring different challenges. And like I said, Dr. Sibu, even at this seniority, he does discuss with other colleagues. We do that regularly. Because it's part of the process of learning for ourselves. For the benefit of the patient and the next patient. Right? So, take the attitude of lifelong learning. And stop learning. At least for the good of your professions. Number two, there are three roles for doctors to take. Right? One is being a good clinician, which is treating patients, being good at treating patients. Number two, see, remember in the medical school, Ayurvedic schools, you are taught by not people who train in teachers training college, like school teachers. You are trained by the doctors who are practicing. So who are the doctors who are practicing? You also in the future will be doctor practicing. So you need to teach your junior. So second role of a doctor is not only treating patients, is to teach your junior. At every level you can teach your junior. The third role, where does the knowledge come from? Even Ayurvedic medicine, although it's kind of it comes from people who accumulated and pass on the knowledge. And you need to grow the knowledge. So if you are in a position, where you can do some research and on the body of knowledge, publish research. You have to publish that research. Publish paper, you add a corpus of what? To the corpus of the knowledge. Because the knowledge has to continuously grow. We always face a new disease. COVID is definitely a new disease. I'm sure very soon we are start seeing the effect of the COVID vaccination and COVID virus. We cannot go back and see the old stacks. No, there was no COVID tag. You need to come up with new populations. So, three roles. Doctor as a treating doctor, clinicians. Doctor as a teacher. Doctor as a researcher. Add on to the corpus of knowledge. Balance it in some way.
You are very, you can make up this. You can ask very fast. You're putting your hand up. You can ask question. Question?
As a token of our appreciation and respect, we would like to present a memento on behalf of Neurosurgery AYURVEDA Medical College. May I now invite Dr. Parthiban sir to receive the memento and Dr. Binoy sir to kindly do the honors of presenting it.
Let me welcome HSA President Dr. Bhagyalakshmi R for word of thanks.
Good evening. So I extend our sincere gratitude to the Professor Dr. Parthiban Sir for this wonderful session. So this was a big opportunity for us to meet an eminent personality and interact. So thank you so much, sir, for you, sharing your journey through neurosurgery and experience. So thank you so much for spending your valuable time with us. And I also thank our hospital superintendent, Dr. Shibu sir, for giving such a big opportunity to meet a legend in our life. So thank you, sir. And I also thank the Vice Principal, Dr. Vinod sir, and the teachers, house surgeons, and all the students who become a part of this session. Thank you.